My name's Karen Woods, and I want to talk to you about my back surgery today. For 35 years, and it just got progressively worse off and on. You know, it would hurt, and I could no longer climb the stairs where I worked except one step at a time, and that just wasn't me. I walk fast, I walk on my treadmill. I was not able to do that because it just hurt too bad. And then it started hurting so bad that the pain was going down into my legs and in my right leg all the way down to my foot. I never knew when I stood up if I was going to fall. I did have several falls. I was also the caretaker for my husband, who had Parkinson's, and his elderly aunt. So when I went to the doctor, the options, I just was in horrible pain, and my primary care doctor referred me to Dr. Hostin, and I met with him, and he ran tests and x-rays, and he explained to me what was going on in my back and the options that we had that were available that we could try for relief. And so because of the caretaking responsibilities, I opted for the injections. The time between the shots got to be less and less. And so my husband passed away, and then his aunt passed away. And so then I started trying to figure out what to do with my back. Really, the injections were at the point where they just were not doing me any good. And I was absolutely petrified because I worked with someone who had back surgery, and he wasn't doing too well. I was 73 years old when I had the surgery, and I just was amazed at the difference. In the hospital, there was no pain in my back. And I really have had no pain to speak of. They sent me home with painkillers, which I didn't take, because if you don't have pain, you don't need them. I followed Dr. Hostin's instructions. He explained the physical therapy and how important it was, and I wanted to have my normal life back. I wanted to be able to do the things that I used to do. My husband and I were big square dancers, so I wanted to be able to do that again, even though I couldn't do it with him. But I just wanted to know that I could. And so after surgery and after I got through my physical therapy, I was back to work. I was off work 6 weeks, I guess, but I could have gone back sooner, except Dr. Hostin said maybe I might be trying to push it too much. So I listened to him again. You know, I can do anything I want to do now. I had the surgery in October of 17. And so it's been almost 2 years, and I would say I'm as back to my normal life as I ever hoped that I would be. And I forgot, you know, how nice it was to wake up in the morning and roll over without having pain and without having to feel like you're going to crumble to the floor when you step on your feet out of bed. So I can't thank Dr. Hostin and his staff. They're all just wonderful. And when I saw him last time, he said, "I'll see you in a year." And so that's just, you know, it's wonderful because he's a great doctor. I would recommend him over anybody. I told the guy that I work with that had the back surgery, I said, "Well, you just picked the wrong doctor."